October 8th, 2016, I woke up and my whole world was different. I could feel a pit, like right in my gut, and it was pure terror. And I started shaking, mostly on my right side, and I didn't know what was happening. And it was literally like I was stuck in a world that nobody else could see, hear, or touch, or even reach me in. And that pit became to the point where I was literally afraid, just afraid of everything. Nothing was happening, but I was scared. I was afraid, and I knew it wasn't in my mind. I knew something had happened. I said, even to my husband, I said, it's like my computer crashed. I said, I feel like my computer crashed, and something is not right. So the doctors that I would see would all say, you seem to be very stressed, and why don't we try this new medication? And, one after another, nothing helped. And along with all these symptoms, the shaking, the anxiety, the depression, the fear, the intrusive thoughts, I woke up that morning also with severe migraine, a migraine that I had never experienced before. I don't even know that I've ever felt that kind of pain like that in my face. And that stayed with me for months. I had that migraine till at least March. And the sensory things that were happening, the lights would cause my eyes to hurt, my face to hurt. The sounds would cause me to feel like I was going to, freak out because there's too much sounds around me. Smells would make me nauseous. All of a sudden, all these things were happening, and I knew something happened and something needed to be done. But I wasn't unable to find any relief through the doctors that I was seeing. When first diagnosed at MGH, I was confused because I'd never heard of this, FND, Functional Neurological Disorder, and I was also kind of angry. And the only reason I would say angry is because I misunderstood. I thought they were saying this was in my head. This was another way of saying you have too much stress, you need to change, the way you live or whatever. In which case I learned through research and asking questions that I was wrong. It is in my head, it's in my brain, and the issue is that I have now a neurological disorder. Working with Dr. Perez has been a godsend. He is so passionate about functional neurological disorder that you can't help but almost get caught up in what he's telling you when he's teaching you about the disorder. You can also tell he's learning, like he's learning what I'm saying so he can understand FND even more from the patient perspective. And that for me has been major, because a lot of times with this type of disorder, my experience has been people are quick to dismiss me, are quick to say, all right, well, this is going on. But to actually take the time, look me in the eyes, comment, and reflect on what I'm saying to show me that I'm actually important to him and my recovery is important, that has made the world of difference.
Functional neurologic disorders, which we abbreviate as F&D, are among the most common conditions encountered by neurologists across clinical settings. Our approach in the MGH Functional Neurologic Disorders Clinic is to take an integrated approach across neurologic and psychiatric disciplines. Patients with F&D present with a variety of physical symptoms, such as abnormal movements, walking difficulty, limb weakness, seizure-like events, or sensory deficits. Also with our program, we emphasize an interdisciplinary approach, not only across neurology and psychiatry, but also very much bringing in colleagues from occupational therapy, physical therapy, social work, psychology, and other allied disciplines.
So Kyla was very motivated to engage in cognitive behavioral therapy treatment right from the beginning. She brought a lot of curiosity to the therapeutic process, and she was very eager to understand more about where her symptoms were coming from. Kyla's also an incredibly creative person, and I noticed that she took a lot of notes during our sessions. And she would go home and had these really interesting ways of synthesizing the information that we had gone over.
CBT treatment here at Mass General has been different than anything I've ever had anywhere else. It's definitely teaching me to change my brain. My brain clearly is sending me misinformation. It's sending me beliefs that aren't even the truth. It's telling me, be afraid. There's no reason to be afraid. It's telling me, get ready, something's going to happen. Well, nothing's happening. So I've learned that I need to really think about and be aware of what these beliefs are and what the truth is. And what CBT is doing is it's helping me change the way my brain perceives the world around me.
So some of the occupational therapy treatment strategies that we implemented with Kyla while she was working with me included exploring sensory activities or strategies that she could use to help with something called self-regulation. Self-regulation is having our mind and kind of body in a just right balance, if you might say. We can be on opposite ends of that balance. We could be very high and stressed, we could be very low and depressed, and our goal is to be in that just right balance and be self-regulated, and that's where we perform best day to day. So with Kyla, we explored strategies such as gentle stretching, maybe using some deep breathing, some meditation, how earplugs when the noises were getting too sensitive for her, fidget tools that you might fidget within your hand when needing a distraction.
From the first day I met Julie, I knew that she genuinely cared. She wanted to make sure that I had every tool that I needed in order to survive in the world, or get back into the world. And I kind of think of her like a parent. She's like that parent that wants you to bring everything with you, so no matter what happens, you're going to be prepared. And she makes sure that you are. She's just genuinely concerned about each and every symptom that you're doing and how can I help you with this symptom. She will go out of her way to find a product if you need to get a product. She will give you all these different opportunities to try different things, tangible things, things that you can actually touch or feel or look through, or whatever. She really focuses on what does this patient need. Working with Ellen has been a godsend. I have never worked with someone like Ellen. She is compassionate, she's energetic, she's very animated, and the way I think of her is like the ideal personal trainer. She can't do it for you. She cannot get your results for you. You have to do the work, and you have to be determined to do it. But she also is going to give you the tools and the technique and the right way to do these things so that you can help yourself. Since starting treatment here at MGH, I have noticed a lot of different positive changes in my life. I always knew there was so much more than what I was living in. I was living in dark, frightening world. It was always very black and white. And what I've learned and the benefit I've gotten is that black and white, I'm starting to see little pieces of color. They're starting to come in. It's like I've always had like that little dark puzzle piece in the huge picture of a puzzle. And all of a sudden, it's like I'm seeing the other parts of that puzzle. If anyone is going through what I go through, my advice would be, don't give up. Don't give up on yourself. My word has become relentless. That's been the word. I will not give up. I will not quit because I am determined to get better. And it hasn't always been that way. Like I said, by the grace of God, I am still here. The pit, the feeling of terror has gotten so bad that it's overwhelming to even wake up in the morning. So I get it. But if you can just trust that even if you go to a doctor and they don't know, then you find another one. If you go to a doctor who dismisses you, then you go to another one. But you can find it. You don't need to rely on everyone for doing this for you. You do it. That's how I ended up here at MGH, is I knew that somehow, somewhere, someone could help me. And for me, Mass General Hospital, neurology with Dr. Perez, Julie, and Ellen is my place. That's the place that is helping me. I knew I'd find a place that would believe me. And you will find a place.
Looking around, Why am I so afraid? The fear inside me no one could explain. No one could understand what was happening to me. They said I was fine, told me it was all in my mind, but I was relentless. I had to fight for my life. No one could see the terror in me. I had to find someone who would believe. I found a place. They listened to me. For the first time in my life, I am believed. I always knew there was so much more than this pain I've been suffering for so long. I found a place. I am shaking, I am drowning, I am so afraid. Someone help me, someone listen, someone please believe. I found a place. They listen to me. For the first time in my life, I am believed. I always knew there was so much more than this pain I've been suffering for so long. I found a place. They listened to me. For the first time in my life, I'm finding me. For the first time in my life, I'm finding